look at the literature coming out with COVID-19, there's been some major concerns about the overestimation or underestimation of the true COVID deaths. And this is really due to kind of the trajectory and timing of COVID as it went across our country, the coding practices used both in the clinic and by the medical examiners, death certificate procedures, the availability of COVID-19 testing and vaccines, and then really access to individual level data. Hi, I'm Suzette Belinsky. I'm a professor of epidemiology at the Mayo Clinic, and I'm going to summarize a paper that will be published in the March issue that's entitled "The Importance of Estimating Excess Deaths Regionally During the COVID-19 Pandemic." We undertook this work because the national data for COVID had excess deaths due to COVID as high as 30% in the first 2 years of the pandemic. Recent work in the state of Minnesota has estimated that to be about 17% within our state. So what we did is we conducted a study in the 9 counties surrounding Mayo Clinic Rochester. And we did this largely because at the beginning of the pandemic, this region experienced low rates of COVID-19. It really didn't hit our region until kind of March or later of 2020. We had wide scale availability of testing early in the pandemic, as well as well-annotated individual level data through the Rochester Epidemiologic Project. And then this region is only covered by 2 medical examiners. So we had, we largely mitigated those issues that we saw nationally because we had, standardized procedures for coding by the medical examiners. So, that's really what prompted us to do this study within our region. And so what we found is, despite prior work suggesting a 30% increase of excess deaths nationally, and maybe 17% it looked like in Minnesota, within our region, our 9-county region of southeast Minnesota, we had excess deaths of about 10%. About half of that was due to COVID. Like other people, those, very old, a lot of comorbid conditions had higher rates of excess deaths due to COVID and non-COVID. However, we did observe a 22% increase excess deaths in our youngest age group, 18 to 39. Again, not seemingly due to COVID. We had very few COVID deaths in that age group. And this in 2020 compared to 2019. And this was not statistically significant, but then it ended up actually increasing when we compared 2021 to 2019 to an increased rate of about 39%. Now we're seeing this also nationally. We're seeing that we had some excess deaths in this young age group. Again, this has been reported more broadly. The rates of suicide, the rates of substance abuse in this age group was particularly high during the COVID pandemic. Okay, so what our study found is that we found 10% excess deaths when we looked at 2020 compared to 2019. When we looked at 2021 compared to 2019, we really didn't see any sort of excess deaths in this region. And these estimates are markedly lower than what's been reported nationally for sure. But this makes some sense because, COVID came to Minnesota relatively late in the pandemic compared to the states on the eastern seaboard. So we learned a lot. Also in Minnesota, we had the lockdown in March of 2020, and Minnesota had a very high rate of COVID-19 vaccination. So that could have mitigated some of our excess deaths. The take home for this is, I think, is that, you really do need to look regionally. These national estimates really don't reflect what happened in more regional populations. So in summary, our work showed that in the region, in the 9-county region around Mayo Clinic Rochester, we had a 10% excess death rate. That's lower than the national estimates that we've seen previously reported. Some of that may be due to the fact that the pandemic hit the eastern states first, and their excess deaths was actually larger than what we observed. Could also be due to some of the issues I already raised, coding practices, differences in medical examiners and death certificate data. So that could be it. So I really think the take-home message here is when we look at COVID and we want to study maybe some of the mitigation factors in COVID, we really need to look more regionally. We need, a lot of times, I think the regional data gives us better data than the national data that we see. Obviously, with the Rochester Epidemiology Project, we were able to have individual level data. So we were able to show a lot of demographics and characteristics of the geographically defined population that was lacking in some of the national studies. So at the end of the day, again, I think Minnesota did a good job during COVID. And I ask you, again, the article is going to come out in March. I asked you to read the article, and it will provide all the details that I've summarized.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.